Hello, I'm Dr. Valentina Pasquantonio, and I'm coming to you for OHP4C, which is the Oral Health Posse for Consumers. The subject matter for this presentation is a new specialty that is forming in medicine. We're going to talk about what specialties are like or how they get formed, what is going on with this new specialty that is forming, what the qualifications seem to be for those who are putting together this specialty because of need. And we're going to talk about the need and why you should be aware of the specialty and how it can help you and those you love. Every once in a while, people who practice medicine, see a need for something that just isn't happening right, that there is a problem and there's nobody there to solve that problem. And they decide that maybe they are the ones who need to solve the problem. So they look into it. And that's how pediatricians first came about. That's how we got orthodontists and dentistry. That's how we have vascular surgeons. Right now, there is a problem, a big one. And some medical professionals are looking at that problem and saying, we got to do something about this. And they're investigating it and seeing what qualifications they would need in order to address this problem. And the first thing they've come up with is that this problem has to be taken care of by somebody who is a physician, who's an MD, a medical doctor. That's a basic qualification for somebody who's going to be this specialist. But not just any physician. It has to be a physician who works with human beings in a clinical setting and who looks at the whole human being, the whole integrated human being. And as they look at the problem more, it's become very obvious that the other qualifications, there are three, by the way, the other qualifications someone would need to help with this problem is that they would need to be a clinical pharmacologist, a PhD pharmacologist. Now, this is different from the pharmacologists that you and I know when we go to the store, to the drugstore, or to the pharmacy. The individuals who do have PhDs in pharmacology and help us with our prescriptions. The clinical pharmacologist in the United States is usually considered to be someone who goes on, who learns a lot about drugs, and who works for drug companies or in universities getting new drugs made, doing research in drugs, seeing how they can form drugs to help people do this or that. But the specialist that is necessary has to be not just that kind of a clinical pharmacologist, but a little bit different. Someone who actually works with patients, who is interested in how drugs work in the real world with real patients who are in trouble. And then the third qualification for this new specialty is that that person has to be a physician, has to be a PhD pharmacologist who is into research, and both of those very much involved with patients. But the third thing is that this individual has to be an amazing detective. If Sherlock Holmes was real, they have to be 20 times better than Sherlock Holmes ever was. What this new specialty will be doing is working with people, patients, who are having problems because the drugs that they are taking are making them sick. Now, he said, well, of course, we know. The problem is that sometimes we don't know the drugs that we're taking are making us sick. And this usually happens after trauma, meaning that there's an accident, or during surgery or after surgery when a patient is recovering. During these critical times, the drugs that the patient has been taking are sometimes suspended because the hospital doesn't know everything the patient is taking, or increased, and then other drugs are added, and not everybody is talking to everybody else. And even if they were, in this particular human being, those drugs have not been given to that person all at the same time. So there are consequences. Over and over again, there are deaths, there are problems with patients who are dying. We think unnecessarily, and we don't know why. And it turns out that it's because of the way that drugs have been acting in their system. And we don't know about it until it's too late. When I first heard this particular statistic, I didn't believe it. But I'm going to share it with you because I looked it up and it is true. 5% of the deaths in the United States actually were, I think it's 4.7 something. Rounding up, 5% of the deaths in the United States are a direct result of a prescription drug that has been given correctly for the correct reason, taken by the patient correctly, but there were consequences. I didn't believe that when I first heard it, but it's true. More and more we are seeing that we need clinical pharmacologists. These special people who probably the specialty won't be called clinical pharmacology, but these physicians who are also pharmacologists, who are also detectives, who can intervene and say, okay, we have this great big soup of drugs in this patient. What's going on? And how can we stop it so that the patient can live and have a good life? Thank you for listening. This is the next to the last, actually, presentation for OHP4C. It's January the 8th, 2022. Thank you. Bye now.